Hey guys, it's Nick with Treasure Coast Physical Therapy and Fitness, and today I want to explain something I get asked many times. What is the difference between recovering from a tibia fracture versus a fibula fracture? Now, even though these two bones sit right next to each other in the lower leg, the recovery process can be very different, and knowing the difference helps you understand your restrictions and what to expect in therapy. So let's start with a quick anatomy refresher. The tibia is the shin bone. It's the big one you feel in front of your lower leg. It carries almost all of your body weight, which means that when the tibia breaks, it's going to impact your ability to walk, stand, or even transfer your weight. The fibula is the smaller bone on the outside of your lower leg. It doesn't carry your body weight the same way. Instead, it's going to provide stability to the ankle, and it serves as an anchor point for muscles and ligaments. Now, because their roles are so different, the recovery process is also different. A tibia fracture often comes from a high-impact trauma, things like a fall, a car accident, a sports injury. It can involve the knee joint above or the ankle joint below, which is going to make the recovery even more complex. A fibula fracture can happen in an ankle sprain from a direct impact or alongside other injuries. Sometimes people fracture the fibula and they don't even realize it, especially if the ankle is the painful part. Now, here's where most patients really feel the difference with weight-bearing restrictions. With a tibia fracture, your surgeon will almost always give you a strict weight-bearing restriction in the beginning. The bone needs time to heal because it's supporting your body with every step. You might be on crutches or a walker for several weeks or even months, depending on the severity of the break. With an isolated fibula fracture, you're often allowed to put weight through the leg much sooner, sometimes almost immediately, as long as the ankle is stable. The fibula isn't the main load-bearing bone, so it can heal while you still move a bit more normally. Now, if the fibula fracture disrupts the ankle joint or there's a ligament injury, then your restrictions might look more like a tibia fracture because now the ankle needs protection as well. So a tibia fracture, it's going to typically take 3 to 6 months to fully heal. Severe fractures, open fractures, or fractures that involve the joint surfaces often require surgery, plates, screws, rods to stabilize the bone. A fibula fracture usually heals in about 6 to 8 weeks, especially if it's isolated and if the ankle remains stable. Surgery is less common unless the fracture affects the ankle's alignment. Now, in terms of physical therapy and rehab, in rehab the focus is going to be different between the two types of fracture. With a tibia fracture, we spend a lot of time restoring joint mobility, especially the ankle movement, knee flexion, and reducing overall swelling. Regaining weight-bearing tolerance, balance, and leg strength takes time because the muscles around the tibia often get weak while you're non-weight bearing. With an isolated fibula fracture, rehab tends to focus more on ankle mobility, ankle stability, rebuilding the smaller stabilizers in the lower leg, and restoring normal walking patterns. The timeline is usually faster than with a tibia fracture. Now, some complications that you want to watch out for. Tibia fractures come with a higher complication risk, including a non-union, the bone doesn't heal together. Malunion, same thing. And something called compartment syndrome, which is a medical emergency. This is why surgeons are very careful with your restrictions after a tibia fracture. Fibula fractures usually have very few complications, but if the ankle joint is involved, you can develop instability, chronic pain, or delayed healing. And the bottom line is, even though the bones are right next to each other, a tibia fracture and a fibula fracture are not the same injury. Again, the tibia is a weight-bearing bone, so the recovery is slower, the restrictions are stricter, and therapy focuses on restoring full leg function. While the fibula helps to stabilize the ankle, so many isolated fractures allow for earlier weight-bearing and a faster rehab timeline. So if you've recently had one of these types of injuries or both at the same time and you're unsure what you can or can't do, reach out to us. We work with fracture recovery very often, and we'll make sure that you're healing safely and moving confidently at every stage. And if you're recovering from a tibia or fibula fracture and you want more guidance, schedule a free discovery visit with us. Just call us at 772-485-9447.